Welcome to Meghalaya Answers. This show is an endeavor of the National Health Mission and the Department of Health and Family Welfare, Government of Meghalaya. In the last few weeks, we collected a large list of relevant questions that deal with everything COVID-19 related. We are here to bust myths and answer all your questions about COVID-19, living with the new norms, clarifying the doubts, and dealing with the fallout of the pandemic. With the festive season upon us and the resumption of tourism and travel, we will first attend to questions related to these very relevant themes. Well, to start with, I would like to ask our panelists, our respected doctors who are with us in this episode, to kindly please, if you can introduce yourself. Can we start with you, doctor?
Good evening. I am Dr. Rajiv Sarkar. I am an assistant professor at Indian Institute of Public Health, Shillong.
I am Dr. Meban Ibor Kharkungor. I am a medicine specialist from Dr. H. Gordon Roberts Hospital, Shillong.
I'm Dr. Robert Marak. I'm the District Surveillance Officer, East Khasi Hills District.
Well, let's start off with the first question, if I can ask you, Dr. Meban. What are the safeguard measures to be considered while joining a religious congregation during this festive season?
Thank you, Bajo. Before I answer the question, to tell you the specifics into what needs to be done and what needs to be avoided, it is very important that the public as a whole still keep in mind this important fact that we are still very much vulnerable to getting COVID-19 infection. So at this point in time, most of us are still at high risk of getting the disease. And it is also important to remember that from the experiences that we've had over the last 1 year, that some individuals are at a higher risk of getting severe disease than other individuals. Which means if we have certain medical conditions, diabetes, hypertension, cancers, on immunosuppression and other such diseases, we are at a higher risk of getting a more severe disease. Having said that, once we understand these important principles, the same precautions that we have been taught, we have been instructed to follow from the beginning of lockdown itself, these things still apply. Which means, as much as possible, try to use the face mask. Hand sanitization still remains an important aspect of prevention, and physical distancing. At the same time, when we are talking about religious festivals, the upcoming Christmas, New Year, there is a tendency to have congregations and to visit crowded places. So as the government is propagating right now, we need to avoid the 3 C's. So we need to avoid close contacts with other people as much as possible, avoid crowded places and closed spaces. So these 6 things, if we follow strictly, with the understanding that if you feel that you're at a higher risk, to not even expose yourself to crowds unnecessarily. I think these principles should protect us to a certain amount.
Okay, so Dr. Meban, in order to enjoy this festive season responsibly, what should we adopt or avoid?
I feel that the words enjoy and responsible, I think they should not be in the same sentence. To go ahead with our religious practices, I think it's very important. But at the same time, we need to do it in such a way that as long as we know that we are still at risk, we don't unnecessarily put ourselves and our loved ones at extra risk. So the same things apply. Mask, hand sanitization, social distancing, and the 3 C's, of course.
Thank you, Doctor. Dr. Rajiv Sarkar, this question is for you. What are the necessary precautions while visiting parks and other recreational facilities?
So parks are open spaces, so we are at a lower risk than closed spaces. And but still we need to maintain social distancing, especially from other groups or people whom we do not know. So stay with our own family members or our people whom stay in our same house. Wear a mask if there are places within the park where there's a crowd. And also ensure that if you touch something, common spaces, then we do not put the hand near our mouth or nose, and then we wash our hands as soon as we return home or before touching or eating anything.
Thank you, Doctor. It seems that not only the people are complacent in following the protocol issued by the government, but there is a loose enforcement of the same by the authority and the village COVID management team. What, Dr. Robert, is your call on this?
Well, I think, yes, the people are becoming more complacent because compared to the earlier days, the fear which was in them has almost disappeared. And what the people feel is that this disease is not going to affect them. They have seen more than 80% of the people being affected without symptoms and recovering well. But we have seen the other side of it, which the people have not seen. We have seen, Dr. Meban has seen, the people who are really affected and suffering from this disease, more than 5%. And yeah, the case fatality is about 1%. So about 1% of those who have been affected have already died, and we couldn't save them because they have reached hospitals at the critical stage. So as of today, we have 133 deaths. That accounts to 1% case fatality rate. So, and less than 1% of our entire population of Meghalaya is already affected by COVID-19. So at this pace, if we continue going on like this, I think we are going to expect another wave. So my request is that people should not be complacent. People should keep following all the protocols laid down by the government from time to time, because we have seen that majority of those who are affected are those between 15 to 45 years of age. Of course, COVID does not select whom to infect and whom not to infect. Everyone is susceptible to this disease, but it's the elderly and the comorbid who are mostly affected.
Yes, so, Dr. Mevan, if you can add something.
To add to that, I've been seeing that a great deal of misinformation is being circulated in terms of COVID-19 pandemic. The majority of our rural people still have a doubt that this disease exists. There is still a lot of misinformation being circulated by social media, by people who can influence the section of the community that is more, not very literate, that are more gullible, so to say. So things like it is all invented by the government. They are just giving false reports to people. So all these things, I feel, contribute in a great way to the people being complacent as far as COVID-19 taking precautions is concerned. But I can assure you, over the last 10 months of treating patients with COVID-19, that this disease is actually a very real entity. It affects, like Dr. Robert said, it does not choose, it does not pick who it affects. The impact on the individuals, on the patients, on the family has been quite significant. Some people have had to sell their land because they're suffering from COVID-19. Some people have been affected in ways that might not they might not even recover, even psychologically, financially, physically, even in the next 1 to 2 years. So, to the general public, please, 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 as much as possible, take the information only from competent, from the authority, from the government side. Avoid WhatsApp and Facebook, Instagram knowledge, which comes from dubious sources. And to not forget that we are still all at risk.
Now, with the onset of this festive season, Dr. Robert, we have seen that people are no longer following protocol issued by the government, like wearing masks, hand hygiene, and physical distancing. What are the steps taken by the department to prevent the surge of new cases or a second wave?
The health department, in fact, right from the beginning of the pandemic, have been taking lots of steps. The government has been focusing on 3 things: educating, appealing, and enforcing. Educating the masses about COVID-19 through various IAC activities, appealing the masses through the different protocols and notifications, and also through press releases. And of course, if you don't follow what you know and all the appeals, there is enforcement and of course penalty and also containment if required of the house which is not following the government protocol.
Can I add something to this?
Yes, please, Dr.
Just wanted to say that, the government is doing what the government can. But as an epidemiologist, I can also say one thing, that there are studies which has been done globally where they have looked very closely at the contacts who are most likely to get COVID. And what is now known, it is a well-known fact that close contacts are the ones who are most likely to get infected. And who are our close contacts? Our close contacts are people who are our family members, maybe our grandparents if they are elderly, and or our friends or colleagues. So it is also important for us to understand that as individuals, we also have a responsibility, because the suffering person, or it will be someone who is close to us most likely than a random person on the street. So this is something also we need to really keep in mind while we are enjoying our festivities.
And doctor, does this COVID-19 virus spread more in the winter months like other cold and flu viruses?
As with all respiratory diseases, it is expected that COVID will spread more in the winter months because viruses are more viable during a colder season. Also, it is important for us to know that during the winter months, what we also do is we tend to stay indoors. We tend to come close together for the warmth. And again, close contact, as we know, is an important factor for COVID transmission. So it is quite expected that if we are not following the protocols, if we are not following the distancing and hand hygiene, that we might see a surge.
I would like to add on to what Dr. Rajiv had said, that we expect that transmission, due to various reasons, we expect the transmission to be much more during the winter season. But over the past years, and this is also known worldwide, that diseases tend to become more severe during the winter. So this does not apply solely to COVID-19. It applies to every form of other disease as well. Because the moment, because if these diseases, for the same kind of a disease, affecting a same person, the severity will be much more during winter. The reason being, a patient is more likely to go into shock. He is more likely to go into hypothermia, and these are diseases that don't go well, especially for patients receiving intensive care. So the conditions, the winter conditions, the cold weather, actually it makes a person to deteriorate faster compared to if the same person gets the same disease during the summer season.
Dr. Meban, what steps do I encourage my family to take to reduce the risk of getting COVID-19? And which is the best kind of mask according to health experts?
As far as masks are concerned, to say which is the best mask, I think it's quite difficult to answer it in a scientific way. Of course, from the medical point of view, when we are taking care of COVID-19 patients, we would prefer to use an N95 mask. However, it has been seen that even the triple layer surgical mask or a cloth mask, cotton mask, is, especially if it's at least bi-layer mask, can provide a significant amount of protection, especially to people, common people. But again, the nature of the mask is not as important as the understanding of how to wear the mask. If we are going to use a mask for the sake of just wearing a mask to prevent a fine in Police Bazaar and wearing it on our chin, even if you wear an N95 mask, it is just as useless as not wearing one. However, if you go to a crowded place and you are only you can only get hold of a cotton mask, as much this mask itself will provide a considerable amount of protection. So classes of masks are important. In the medical field, I think that is a different topic altogether. But as far as the general public is concerned, we need not focus on getting the best mask. We should be focusing more on appropriate use of mask. If I am to touch articles and lamp post and shake people's hands in Police Bazaar, even if I'm wearing an N95 mask, I'll take a betel nut, roll it in my hand and put it in my mouth without prior sanitization of my hands. I think that again becomes useless. So one, not focus on what type of mask you're using. We should be more focused on how to wear the mask, when to touch your mask, when to take off your mask. So that is much more important than knowing what is the best mask to use.
And doctor, is it safe to play sports at this time?
Depends on what type of a sport we are talking about. For example, outdoor sports are safer than indoor sports. Sports which are more individualistic, like running, is probably safer than a group sports like basketball or football or something. And if we are playing any kind of a sport, it is also advisable, if possible, to bring our own equipment. For example, if we are playing cricket, there's no harm in playing cricket. It's an outdoor sport. It's a very nice sport. It keeps us physically fit. But try to bring your own gloves if possible. And then if we are playing indoor sports and then there are more than one group, ensure that there is enough distance between the two groups. There are two different teams practicing, for example. Ensure that there is enough distance. Or if it is better even to say that one team goes off, then the other team goes in and plays. So, keep those precautions. Try to maintain as much physical distancing as possible. And of course, when you're in a sport, we touch different things, different objects. Try not to put our hands in our mouths or bring it close to our nose. And then when coming back, before touching anything, wash our hands properly.
Well, that's just about it for this episode, but stay with us. We have more answers from our experts on our next episodes.